Sure. In this study, we found that those who drink heavily have an increased risk of becoming pregnant when they do not want to be. And these findings are similar to what's been found in prior research. However, what's different here is our approach. We've conducted this study in a more rigorous way with a particular attention to how pregnancy preferences are measured. So from a public health perspective, this is an important research question because there are clear harms from fetal alcohol exposure, as well as, of course, high rates of unintended pregnancy in the United States. And this study in particular, in terms of our improvements on methodology from prior research, studies have been mostly conducted categorizing pregnancy in a more black and white way as either intended or unintended, which fails to capture really the range of feelings that we know people can have about a potential pregnancy. And often those preferences are measured retrospectively, or historically they've been measured retrospectively, either during a pregnancy or after a childbirth has occurred. And in this study, we use a novel scale called the Desire to Avoid Pregnancy Scale, which allows us to capture more nuance and the full spectrum of pregnancy preferences. And we do that prospectively, so prior to a pregnancy occurring. So that's an important question. These findings really highlight the need to better support people who drink heavily and who want to avoid becoming pregnant. The goal here is not to change individuals' pregnancy preferences based on their health behaviors. For example, by automatically recommending that those who drink heavily should use a long-acting reversible contraceptive like an IUD or an implant. But rather, the goal is to support people in attaining their pregnancy preferences, whatever they may be, in a healthy and a respectful way. So, specifically for those who drink heavily, that might look like making sure that they are aware in the first place that there is an increased risk of pregnancy associated with that behavior. And then also working with them to find a contraceptive method that really fits their needs and preferences. So the next important step is really to understand how and why people who drink heavily tend to have a higher risk of pregnancy. So we need to explore whether heavy drinking is related to contraceptive use or to other sexual behaviors, and in turn, whether those associations depend on the extent to which one wants to avoid becoming pregnant. This particular study is continuing to follow participants through their pregnancies, which will enable us to examine whether people with less desired pregnancies are more or less likely to continue alcohol or drug use during the pregnancy. So, unlike for heavy drinking, we did not find that people who use cannabis are at increased risk of unintended pregnancy. And there are some possible explanations for why we see an association for alcohol, but not for cannabis in this study. Perhaps, for example, there's more unprotected sex associated with heavy drinking, but not with cannabis use. But really, there isn't enough literature on cannabis and unintended pregnancy yet to really understand what the relationship is. This is just a start in attempting to understand whether and how cannabis use is associated with pregnancy preferences. I would just end by saying that the reality is that people who are drinking heavily and do not want to become pregnant are still becoming pregnant. And so it's important that clinicians need to find a way to work with all individuals, including these, to help them meet their preferences.